Are you suffering with pain on the outside of your knee when you run? Is it the kind of pain which stops you in your tracks and makes it so that you can't bend your knee? Well, today I'm going to unpack what that might be and how we might treat it at my clinic in Southwest London. My name's Ed. I run a physio practice in Southwest London, specializing in treating knee pain in runners. So let's get started. Maybe you're in the middle of a run and you just start to experience a knee pain that you don't normally feel on the outside of your knee. Or maybe this is a problem that has been there for quite a while, and every time you kind of increase your mileage, the knee just gets really, really angry. And it's the kind of pain which stops you running, makes it really painful to bend. Going up and down stairs is a nightmare. And even just keeping the leg straight is all you can do to keep the pain down. Now, this is most commonly caused by something called iliotibial band syndrome, which is where something on the outside of the knee gets really, really irritated due to the amount of training that you're doing. And what happens is every time you bend your knee, that bit that's irritated gets more pressure put through it. So when we go from a straight knee to a bent knee, the bit that's angry gets compressed. So it doesn't like that. So it's therefore very, very painful. And I call it the Tin Man effect. So it's where you basically just don't want to bend your knee. And when it's really, really bad, just keeping the leg straight is all you can do to keep the pain down. I've had that problem before. I was training for a marathon. I was increasing my mileage too quickly. And some of my friends have had it before, and they said if they've called me and have been so worried because the pain response can be so high, it feels like they may have done something really, really serious. But again, today I'm going to share with you some of the tips that we would give people how to get rid of this, and none of them involve stretching, which is contrary to what the majority of the internet says. So, like I said, the biggest cause for this kind of problem is an increase in training loads. So that means someone increasing the amount of running they're doing too fast, increasing the intensity, the volume, or maybe not recovering as well after each run. And the fat pad that lives on the side of the knee gets really, really angry as a result. So what we need to do at the start of someone's treatment with this kind of problem is just reduce the training loads. That doesn't mean bed rest. It means halving the amount of running you're doing. And sometimes there is a period of time where we do have to let things settle if it's really, really irritated, but we need to alter the training loads in some way, shape or form, because resting it and then going back to what you were doing is just a recipe for disaster, because it's just going to keep coming back. So we need to let things settle. And some people use cross training during that time so that they can continue building up their fitness. And some people use, lower intensity running, so just going really slow on those really kind of slow, easy runs, so that things can settle down. So you kind of can't really fight against it with this type of injury. The second thing we would look at is someone's biomechanics and look at, are there any muscle deficits, any strength deficits, and start to work on some of the areas that typically would not be doing their job to make this area get irritated. Now, we never want to kind of follow a recipe with this kind of injury, so we'd always assess our patients. I had a patient recently who had sprained his hamstring, and that was really, really weak, and that was what we focused on with him. So yeah, that was a big part of the focus and the treatment for him because of an old injury. But someone else may have had an old sprained ankle, which might mean we focus on the calf strength. Someone else might have no injuries at all previously, and there may still be areas that we need to focus on to build up the strength. So rehabilitation, strengthening work is really, really key for this kind of injury. And typically we would be working on your hamstrings, your quadriceps, your glutes, your calf muscles. And interestingly, there is a lot of research around your hip abductor strength, also the muscles involved in rotating the leg. So again, your hip abductors, adductors help to control the transverse plane in your hip along with your glute max. And they're muscle groups that we would like to normally pay a lot of attention to as well. So we'd be doing things like high step ups, side planks, side lying hip abductions, bridges if it's really irritated and we just want to kind of start with something fairly straightforward, maybe some RDLs, maybe some Bulgarian split squats, lunges, towards the end of someone's treatment, all to really target that kind of proximal chain basically. So we need to get control of that transverse plane, so that kind of rotational plane of movement, and the frontal plane and the sagittal plane. So rehab is going to be a big part of how we treat this type of injury, but not as important as training loads, like I said earlier. The third most important thing for treating iliotibial band syndrome is thinking about someone's running technique. Now, changing your running technique isn't always necessary. In fact, it takes a lot of effort, it takes months, and it's often not something we need to resort to really. But what we can do is use our knowledge of different running styles to think about how we can get the knee doing less and get somewhere else in the body doing a bit more. For example, if someone has a really low cadence, we know that if we increase the cadence, then more often than not, that should reduce some of the pressure and effort and load and work the knee has to do. So therefore reducing irritation in the iliotibial band and insertion. So that's an option that we would look at, potentially incline walking, running. That's another way which we could get the posterior chain doing more and quads doing less. And again, less load into where it's really, really irritated. So running styles can be something that we can impact and change and use to help someone get back into running, so that they're not having lots of time out of running. Other modalities that we might consider using if someone has really stubborn iliotibial band syndrome that isn't getting better. Again, these are more not last results, but things that we wouldn't typically use as a first line of treatment, but maybe when someone's really not improving, something like shockwave injections would be something that we would consider. I've had some really good results with using complex machines. So that's like a muscle stimulation type of treatment, which is where we would use a muscle stimulator whilst we're doing rehabilitation to stimulate the different muscle groups, and have had some really good results with that as well. Stretching, if you look at the research, your iliotibial band is incredibly strong, and it would require something like over 500 kilos of load to actually move and stretch. Any iliotibial band stretches you're doing won't really be having the effect that you think they are, but if they're having a pain relieving effect, that's great. But you don't have iliotibial band syndrome because of tight IT bands, I'm afraid. And any benefit you're getting from stretching your IT band is just pain relief rather than them actually being lengthened. So something to consider. Same with massage, Theraguns, or needling. Again, if we get some quick wins, we get someone feeling better, that's great. But when we look at the research, if we had that as the only treatment that we were doing, we wouldn't really get the results that we're looking for, apart from if someone was resting and not running, and that was having the benefit basically. So hands-on treatment isn't a waste of time, but rehabilitation is definitely more evidence-based and would be what we would be using in the clinic much, much more. If you have any questions about iliotibial band syndrome, you can leave a question in the comments box. I'll do my best to answer, and I'll see you on the next video.